Lisa Palmer, Dr. Bear, coming to you live from Central Florida. Hopefully you guys can hear me. My mic is working okay. So let me know if you guys can hear me. If I'm coming in loud and clear, last couple of times this mic has not been working properly, so hopefully it is working a-okay. So it is working. If you can come, you can hear me okay. Hopefully that is the case. Tonight's topic is radiation scares, ridiculous events, and rad patients, awesome patients. And so with the ARM theme or the R theme, I want to say hi to Rabbits Roost. So hi, Rabbits. You are part of the R team today. Hey, Desiree. Hopefully you can hear me. Let me know if you can hear me, Desiree. Okay. Hi, Alyssa McCool. Alyssa McCool is a rad patient. Melinda. It's echoing again. Oh, gosh. Hi, Cam. So Melinda says it's echoing. Let me know, Desiree, are you hit echo? And if so, I'm echoing. Oh, man. Okay. Support. Come help me, please. If not, I'm going to lose mic for the time. Oh, here comes my handsome tech support. It's echoing. Isn't my tech support some? He's trying to stay out of the camera. So echoing. Okay. Let me know. Is it still echoing? So Lisa says yes, it's echoing. Lisa says yes. So let me know after tech support in if it is no you're echoing. Instagram, it should be fine because you're not attached to this mic. Hi, Vilo. Yes, Vilo says I'm echoing. Is plugged in the right part? No, because I had to unplug it. Liz, we're still echoing. Republican says there's no echoing. Terry's echoing. So I don't know. Before I traveled with this mic, it was working fine. Working so fine. Isn't that the camera? Huh? Okay, let me know. Is it so now it's still talking? Wow. All right. So I'm getting double words. All right. So I'm about to use this mic for the fourth time. I'm so sorry, guys, on why this is happening. Tech support still here. And he has no idea. Okay, Robin says ring. All right, let's get rid of this mic. See that on that mic. Oh. Do the macro. Okay, so we dumped this mic. Is it okay now? So I don't know what's up with the mic. We'll have to troubleshoot that. So please let me know. Double thumbs up if I'm no longer echoing. And Desiree says hello, tech support. Dayton says perfect. Melinda says better. Lisa says yes, awesome. Robin says yes. Thank you, guys. Thank you, Alyssa. So don't know what's happening with that mic. This is the fourth time I cannot get that to get set up properly. Who knows? Maybe it didn't like a field trips out of the studio, but cool. All right. So tonight's topic is radiation scares, ridiculous events, and rad patients. So I have some rad patients on this feed. They are awesome. Due to HIPAA, I am not supposed to say who they are, but if you know you're a rad patient and you want to say something cool, you totally can. I'm not supposed to say due to protecting your privacy. Okay, good. So radiation scares. So by the way, I'm Dr. Lisa Palmer, Dr. Mama Bear, coming to you live from Central Florida on radiation scares, ridiculous events, and rad patients. Desiree says, I'm a rad patient. Robin says, ha ha, and says, true, we're so cool. You guys are so cool. And so I had a patient actually email me today, and she was very concerned with the things happening in the world, which I know a lot of us are. I can't believe, I remember when Trump was in office and gas prices were the lowest I've ever seen it in such a long time. It reminded me of the years that I lived in Georgia, and we had under dollar gas. Like it was 99 cents or 80 something cents. It was crazy, right? And so when President Trump was in office, it was really low. It was like $1.20, $1.15. And I'm like, this is amazing. And today I drove by the gas station. It was over $4. That is insane. We do have oil in the US. We did have a pipeline that was being constructed, and those plans got halted. And so to me, there's that falls under ridiculous events, right? So in my opinion, shouldn't be happening. But the patient's concern was radiation, right? And so she's concerned, and the whole point of this video is not to panic anyone, but her concern was a radiation event, right? Also known as nuclear war. And so she was asking me about iodine. And so we know that you have common sources of radiation every single day, right? So from your cell phone to your laptop and your desktop, to your iPads, your wireless speakers, your Bluetooth, your wireless video games. If it's electronic and it has no wire, there's going to be some radiation involved. If you go out in the sun, you're going to get exposed to radiation. If you fly in an airplane so close to the sun, you're going to have exposure to radiation. And so it is very, very challenging to eliminate. You basically can't eliminate it, but there's things that you can do to help mitigate it. There's things you can do to lessen your load. There's things that you can do to help your body handle radiation. And why would you even care about radiation? Well, radiation can make you nauseous. Radiation can make you lose your hair. Radiation can be toxic. Radiation can grow cancer cells. Radiation also can kill cancer cells. So that's pretty wild. Radiation can get stored in fat tissue and make you gain weight. Radiation can negatively affect your endocrine system, especially your thyroid gland. Radiation cannot harm you. Radiation can be detoxed with the addition of iodine, right? So iodine, you need iodine to have a thyroid that's functioning properly. So when people tell me that they're allergic to iodine, I'm like, you can't be allergic to iodine because you need iodine for your thyroid to work. If you were allergic to iodine, you would be dead because you'd have no iodine in your body for your thyroid to work, right? So, but you can have reactions to iodine. And sometimes when people have reactions to iodine, it's actually a detox reaction. Now, if you're severely allergic to shellfish or severely allergic to something, I'll repeat that, I am not advising you to go eat that thing, okay? However, you may consider, under a doctor's care, you may consider looking at natural sources of iodine. So what would that be? Kelp. So if you like your sushi with the green stuff, that is seaweed, it has iodine. If you like sea salt, that has iodine. If you take supplements, some supplements have iodine. So probably my favorite, actually I have two favorites. Can you have two favorites? It's like, who's your favorite kid, right? So CT iodine from Cellcore is one of my most favorite iodines, okay? So in this, it has iodine from potassium iodide and iodine. So iodine and iodide. There's two types of iodine for your thyroid. If you look at your thyroid is like a bow tie, and you have the wings of the bow tie or the wings of the butterfly, if you look at it like a butterfly, are your parathyroid glands. Your parathyroid glands are responsible for your bone density. Okay, so some women and men that are having low bone density, bone density numbers on a bone density scan, it may be because the parathyroid is not working properly. So if your parathyroid numbers are not right, we need to look at your thyroid function. We need to see what's going on there, because your thyroid gland controls how much energy you have. Your thyroid gland controls if you're exhausted. Your thyroid gland controls whether you feel too hot or you feel too cold. It controls your metabolism. It controls your hormones. It controls weight gain, weight loss. So I have some women that I work with, and they're really mad because they're eating perfectly. They're working hard in the gym, and they cannot lose any weight. That could be due to thyroid malfunction. And your thyroid may be malfunctioning even though your thyroid numbers are okay. So CT iodine, so we have this at the office. CT iodine is a very good form of iodine. There's two different forms in there that bind to the receptors, that bind to like the little keyholes in the thyroid gland to get that thyroid gland to function properly, okay? A thyroid that has adequate levels of iodine cannot have thyroid cancer. Okay, so that comes in from different research that says it is pretty much impossible to have thyroid cancer when you have iodine. And in fact, iodine will help detoxify radiation. And so you're going to hear more and more about iodine. I would consider you guys, or I would suggest you guys get some iodine if you need to know how much to take, if you need to know what to do with it. We're happy to help you as a patient. My second favorite, or kind of close to the top iodine, was the Noble Patriot iodine, which we can't get anymore. And so the next best, in my opinion, is the J. Crow's Lugol solution iodine. So this is also potassium iodide made from distilled water. And so for patients that their thyroid's very temperamental, so I was talking to a patient yesterday, and her thyroid, doctor keeps turning up her thyroid medication and turning down her thyroid medication and turning up her thyroid medication. And those of you that are on thyroid medication, you may know this, right? Like the levothyroxine, they'll give you more, they'll give you less, they'll give you more, they'll give you less, and it's just this back and forth. And I would hate to be an endocrinologist because it has to be so frustrating for them, right? So someone with a thyroid like that, this may not be the right iodine. So we would test using the quantum testing. Instead, it would be something like this, a topical. I like the topicals because they can be absorbed slower. So I have to do a shout out for Talia. So hi, Talia. She is the sweetest little girl. She always says hi to me when I'm live, but I can't tell because I'm live, and her mommy commented. So I want to say hi to her. She's so sweet and I love her. Thanks for the kisses. Mwah. Kisses back. Hey, Kathy. All right, so with the J. Crow's, what I do, so this is actually what I do for myself, is this is a dropper. So you guys can see that it is red. It does stain. So don't get pissed at me if you stain your white shirt, or I had a patient broke a bottle on her white kitchen cabinets. I didn't do it, okay? But I'm letting you know it does stain. And so what I do is I'll just put a little bit on my hand, just like that, and rub that in. Now, wherever you rub it, of course, that flung down my arm. That's great. Wherever you rub it, it will turn it yellow. So I don't know if you guys can see that. You can see a little bit on my hand. It'll turn it yellow. I tell patients sometimes to put it in the inside of the arm. So I'll show you what that looks like. Okay, on the inside of the arm, how many drops? We would dose you to tell you how many drops. But a good indicator is, see how that's yellow right there? If you guys can tell, it kind of looks bruised. That's the iodine. Is what will happen is your skin is your largest organ. So your skin's the largest organ. My skin is going to absorb that iodine and take it to my thyroid or wherever else it needs it and absorb it. And I bet you by tomorrow, so tomorrow is what, Wednesday, by tomorrow, you won't even see this. So Robin, if you're coming in, you can let me know, do you see if it's yellow or not? Actually, it must be pretty low because I don't even see it on myself. So I'm going to put a little bit more. But we would dose you to tell you how many drops to put on. If you're not sure, you can put 1 drop on and see, does it get sucked into your body right away? It means your body really needs iodine. Does it hang out there for a bit? Then it means that it may not need as much. So again, it's very hard to see. I'm under the light. So under this light on my desk here, I can now see the yellow. You guys can kind of see it. But this lighting is not very conducive. Ow, ow, ow. The top of that lamp got hot. Let's see if I can do this without burning my fingers off. Let's use this piece of paper. Let's not set anything on fire. Woo! All right. It is amazing how hot the top of this lampshade is. Whew. So this is what I was trying to get off. It is extremely hot. Okay. So I took the lamp off. So now you guys can see how yellow that is? That's super yellow. So we'll see how fast that absorbs. All right, so detoxified iodine, I'm going to put that back on. It's super bright. Okay, so that is the J. Crow's Lugol solution. Dr. Dean and I were just talking about carrying this because we can't get the Noble Patriots iodine, topical iodine anymore. So this is my next favorite. The next in line would be our GF thyroid. So the source for the iodine in here is from kelp. This is a really good product for people with thyroid issues. Okay. So it also would help to displace the radiation. Robin says, if we have the detoxified iodine, how long does it last in the bottle? Robin, if you bring it in, I'll test for you. Dayton can see it. Jonathan used the detoxified. It was cool how fast it was absorbed. So yeah, it is interesting how fast it's absorbed, but it's not cool because the faster it's absorbed, the more depleted the person is. So if I wake up tomorrow, oh, you can see that better now. If I wake up tomorrow and this is still yellow, it means I was really depleted. If you put iodine on and it stays the whole day, it means your sources are pretty good. For me, depending on the stress in my life, usually 1 to 2 times a week, I do this and I'm good, right? Intake. I intake it. Do you? I do 1 or 2 drops. So yeah, Denise, some people take it orally. You could do that. I just like topically because I tend to be a sensitive case myself. And if I do too much iodine, so one of the signs of too much iodine is that the thyroid can get overstimulated. If the thyroid gets overstimulated, your heart can race. You can have shortness of breath. You can lose hair. You can lose weight. So now some people are like, oh, Dr. Palmer said you could lose weight. No, you don't want to do it like that. Okay. You don't want to do it like that. Alice says, I use the CT iodine pills. I'm happy they are small and easy to swallow. Yeah. So CT iodine, if you want to see them, they are little ones, little guys. So they're little tablets just like that. Okay. If you don't have radiation protection on your desktop, on your laptop, on your cell phone, in your house, at your place of work, at your kid's school, you want to go to protectpro.net. So let me put the link, protectpro.net, and the shipping code. We do, you do get free shipping, and we do get a commission on this. Shipping code is JD for Jason Dean. And you can get devices for your cell phone. You can get devices for laptops, desktops, your house. You can get a little device that you can put in your kid's backpack, and it'll protect your child and the kids around him or her in school. Okay, so then today I was playing with a site, which is cool and not cool. And it is called Antenna. I'm going to put the link, antennasearch.com. And so if you guys click on this, it will tell you how many antennas and how many towers are around you. So I was just curious to see, because I would assume that the closer you are to antennas and the closer you are to cell phone towers, the more radiation exposure you would experience, right? So I plugged in our office address in Central Florida in a city called Longwood. And near our office, we have 161 towers and 456 antennas. I was like, oh my gosh. So then one of the things I noticed about this house is that my cell phone signal here is not amazing. So those of you that are on Instagram, I'm streaming through my phone. Sometimes it drops you guys. I super apologize. But one of the reasons why it drops you guys is my house. So my office has 161 towers by it. My house, which is not that far away from the office, only has 84 towers and 190 antennas. So you guys can look and see how many antennas do you have near you. My old house had 38 towers. That's it, 38. That's like unheard of. So the office has 161 towers, and my house here has 84 towers, and my old house had 38 towers. So it was more rural where we used to live. And 147 antennas compared to the 190 at my house here and the 456 antennas at my office. So I was curious, closer to metropolitan Orlando, closer to downtown Orlando, I thought of what would be a landmark, or what would be a building that I could put into the search to see how many towers and how many antennas. So I thought, I'll put in what I think of downtown. I think of the Amway Center, right? The Amway Arena, where we have concerts and we have plays, and where the The ice hockey team, the minor league ice hockey team plays, and where the Orlando Magic play. So you guys should totally guess. Yeah, Desiree, you should totally look up Disney for me while I'm on. So I thought, well, how many compared to my office? So my office has 161 towers by it, right? It's higher than my house here, my old house. Guess how many towers are in downtown Orlando next to the arena? Downtown Orlando by the Amway Arena has 521 towers near it. That is crazy. 521 towers. That is insane. So Robin says the SunTrust building. So go ahead, Robin, search on that link, the SunTrust building, and see. But the Amway Arena, downtown Orlando, 521 towers. That means if you work in downtown Orlando, you're being fried. You definitely want to be on an iodine. You definitely want to have some radiation protection, right? And then antennas, I had to search it twice because when I saw the amount of antennas, I was like, are you crazy? So amount of antennas. So just to give you relations. So here, out Dr. Gal has 13 towers and 51 antennas. So I don't know where you live, but that is amazing. Like that's very little. Alice says she has 3 towers and 110 antennas. So again, Alice, I don't know where you live, but it sounds pretty rural. So downtown, the Amway Arena, downtown Orlando, 521 towers, 969 antennas. 969 antennas. So if you're in the arena, I was like, oh my gosh, I never want to go to a concert again. Not that I do, but I was thinking, oh my goodness, 521 towers, 969 antennas. Now it does a certain mileage circumference, right? So I think one of the reasons why my old house numbers are low is because part of that is a lake. And I think some of the numbers here are low because part of it is a state park in my circumference. But Amway Arena, it's like, to me, it's downtown Orlando. So if you worked near the arena, I don't think the numbers are going to change in a good way. I think they're going to go up. So Desiree says that's crazy. It's absolutely disgusting. Desiree, I would wonder that Bank of America building in your downtown, I wonder how many are on that. How many are in that area? Robin has 139 towers. So Robin, that surprises me that it's less than the office, but more than my house. That's interesting. Denise says I have 105 and 390 antennas. Oh my gosh, in California. Robin says 335 antennas within 3 miles. Oh my gosh, Robin. Lily has 45 towers and 40 antennas. Oh my goodness, Lily. Denise says towers. Okay, got it. Oh, 393. Oh, 105 towers. Somehow I knew that, Denise. I know I was just there an hour ago eating dinner. Oh my goodness. Okay, so we can all agree that radiation is a problem. So that's external sources. That it's not even thinking about your laptop, your desktop, your cell phone. There are so many people that hold on to devices all day long. If you have one of those watches, like a Apple Watch, that is also radiating you. Kathy says 58 towers and 350 antennas. So Yasky, you can find out by going to www.antennasearch.com to find out how many towers are in your area, find out by your house, and how many towers and how many antennas. All right, so radiation is a problem. I gave you 2 solutions. One is take some kind of form of iodine, right? Okay, so if I'm not your doctor, then you need to become one of our patients, or if I am your practitioner or you work with one of my practitioners in the office, ask them and they'll let you know which is the best iodine that you're testing for. Or you can go to protectpro.net and protectpro.net, and you need to go to protectpro.net to get radiation protection for your devices. Okay, so ridiculous events. I find it comical. Then I feel sad. Then I feel worried, and I'm kind of like up and down, right? Like I'm shocked, but then I'm not shocked at what's happening. And so I told Leah, I told our daughter at dinner, I said, you know what? Get ready. We're going to get chickens in the spring because, like, this is ridiculous, right? I already have my stuff for our garden. So I'm going to get my garden probably going this weekend. We are on a well on purpose and we've been stocking food. My husband buys those big buckets of disaster food. We have those. So I'm not saying these things to upset you. I'm not saying these things to make you worry, but I am letting you know, hey, you know what? Last week, gas was $3 in Florida. Today, it's $4.20 in our area. We have patients in California, they're saying their gas prices are in the $9 range. That is insane. Okay. These prices are going to have a negative effect on our economy. It already has. And so what do you do? Right. So for me, instead of going into panic mode, I go into prepare mode. Right. So I'm like, okay, I got the garden's going to be going. We got our chickens that are going to come. My father went through let's try English. My grandfather went through the Great Depression and they raised rabbits. I'm like, okay, well, when I was a kid, I had rabbits and they reproduced like rabbits. Should I get rabbits again? I don't know. What are good rabbits to eat? I don't know. How do you eat a rabbit? I don't know. How do you butcher a rabbit? I don't know. But can I learn? Sure, I can learn. I could probably watch a video on YouTube on how to, I almost said dissect. That's the medical term. What's the right term I'm looking for? How you butcher, I guess, is how do you butcher a rabbit? I don't know. With chickens, I don't know about chickens. I have friends that have chickens, so I'm sure they'll teach me or I can learn about chickens, right? I'm not on an HOA on purpose because I want to be able to have a garden. I want to be able to have chickens and I want to be able to have rabbits and I want to be able to have security dogs and I want to be able to do whatever I need to do, right? So don't panic, just prepare. Get your propane tanks filled, get your gas tank filled. Look at what can you do to conserve, right? So my husband and I both drive in the morning. Do we need to do that? Well, sometimes I leave earlier than he does, or I leave later than he does. Do we need to do that? I don't know. Could I ride my bike to work? I could. Do I want to? It's been crazy lightning storms. So, is that a good idea? I don't know. Let's see. Nebraska is $3.79. Oh my goodness. Oh, butchering. Thank you, Noble KC. $3.72 in northern Colorado, $4.30 in New Jersey. Won't comply. Just bought a chicken coop, so let me know where you got your chicken coop. One of my friends has a neighbor, and this is kind of a cool idea. They took a shed, like a small shed, and they put chicken wiring around that, and the shed is the chicken coop. And I kind of like that idea because it's very sturdy. And I'm assuming that you would be able to store some of the chicken, like what you need for chickens in there. And then I don't know, it seems like the people that I know that have chickens end up getting more and more chickens. So if you had a shed, it was decent size, it seems like you would be able to have more chickens, just saying. Lily says $3.79 in South Carolina. And my California patients, let me know what is gas, or my California friends, let me know what is gas prices for you guys. When I lived in California, I lived in Northern California, finishing out chiropractic school. And when I was there, gas was $4 and it was crazy. I'm like, why is gas $4 in California and $2 in Florida? It's insane. Kentucky is $4. Wow. And unfortunately, it just looks like these prices are rising. Robin says, I have 4 friends with chickens in Orlando. Cool, Robin. Maybe we should do it. Maybe we should do a chicken seminar. So you guys will have to let me know if you want a seminar on chickens. I'll have to find a chicken expert. Karen says, my neighbor had chickens, but rats were tunneling in under the wire walls of the coop. He got rid of the chickens because he couldn't keep the rats out. Oh, gosh. So some of my friends have dug about a half a foot, 6 inches down to prevent that because raccoons get in there too. California is $6 and $7. Sacramento is $9. Sacramento, Northern California, $9. Wow. Texas, $4. Kentucky, $3.69. So guys, prepare. The cost of things are going to go up. Anything that you need that's heavy, any heavy shipping items, get them now. If you need stuff from the office, get it now. Do not use chicken wire, use hardwire cloth. Oh, cool. That's a cool idea. So yeah, any chicken tips, please let me know. And then what's the best kind of chickens? Because there's all different types of chickens. So how do you know what kind of chicken to get? I like the chickens that lay the different color eggs because I think it's cool, like a blue egg. That's kind of cool. Like it's like green eggs and ham. But I don't know. I don't know. What are healthy chickens? Where do you get the chickens? I know they send chicken eggs in the mail, which to me is crazy, but okay. So any chicken tips, go ahead, post it while I talk about rad patients. So I have the best patients in the world. They are so cool. They are awesome. One of my new mommies had a beautiful baby girl, and she sent me the sweetest thing. She sent me a mama bear mug with the perfect colors that I love. I love teal. I love light blue. I love, like you can see the picture behind me. I love ocean scenes. So she sent me a mug. She sent me a bundle of sage, and she sent me a candle. And I just thought it was the sweetest thing. I'm like, she's the one who had the baby. Now I did send her adorable baby clothes. But I just thought it was so thankful. And she sent a little note that said, "Thank you so much, Dr. Palmer. I couldn't have done this without you." And it's not the gift that warms my heart. I mean, I appreciate it, right? But it's more so that I made it a difference in a mom's life that is going to spill over to the rest of her family. And it's giving her baby the best chance in this crazy freaking world, right? So in this crazy world, we need really healthy, strong babies, right? We need really healthy, strong kids. You guys need to be really healthy and strong, right? And so I was just so appreciative of those words. She's so kind. Um, another one of my patients, he's had like crazy last year. He was in a boating accident. He saved a lady from drowning. He was in a car accident, survived that. I mean, the man has like 9 lives. He's such an interesting guy. And he sent me a message. He said, "Dr. Palmer, I love what you're doing." And he's in the medical world, right? And he says, "I love what you're doing." He said, "Please tell me when your next quantum nutrition testing class is, your next seminar is, because this one's sold out, guys. The waiting list is full. It is sold out. It is, we increased the room size. That's like filled. It's so awesome. I have colleagues coming from as far as Alaska, Maine, New York, New Jersey, Texas, California, Florida. I mean, it's just the coolest, right? And so he said, "Please tell me when your next class is because I have a heart for seniors." And I thought, that's so sweet. You know, I'll admit they're not my favorite population. So if you're a senior, it doesn't mean I don't love you. But my background's all sports medicine, right? So back in the day, all I worked on was professional athletes. And I thought anybody who wasn't a professional athlete was a waste of time, which is a horrible viewpoint. And I don't feel that way anymore. So don't think I'm a bad person. But I love mamas. I love working on moms and I love working on kids, right? And elderly, I have a heart for them, but it's not my passion market. Now, my mom used to work with us. I don't know if you knew that, but my mom used to work with us. She's a nurse and she loved working on the older generations. And so this patient is like, I'm in the medical world, but I really have a heart for the elderly and I want to learn quantum nutrition testing to really help them. And I was like, "Oh, that's so sweet. That's the sweetest." And so, the patients, the rad patients, the awesome patients, the amazing patients we have are just getting so many wins. Sometimes I think about, is there a case that we can't help? Is there a condition that we can't help? Is there a disease that we cannot help? And I don't know of any, right? Because every single condition, every single disease, every single problem has a cause. Sometimes it's mold, sometimes it's parasites, sometimes it's chemicals, sometimes it's metals, sometimes it's radiation, which we were just talking about. And so if you can identify the cause, and quantum nutrition testing allows us to identify the cause, I can figure out what's causing it, then I can figure out what supplementation will rebalance the body. And if I can rebalance the body wants to heal and amazing things can happen. The only patient case that we won't accept is someone who doesn't want to get better. And so and I know that sounds crazy, like I've had patients where, I'm like, "Okay, this is what we found and this is how we can help you." And they're like, yeah, but I'm on disability and I don't want to get better. I don't want my workers' comp claim to go away, and I don't want to be taken off disability. And I'm a Hashimoto's case, or I am a fibromyalgia case, and the person's like identified with their disease, they have identified with their condition, and they've almost like became the disease or the condition. And so they always are talking about their rheumatoid arthritis, or they're always talking about their Hashimoto's, my Hashimoto's, or they're always talking about their heart condition or their digestive condition. And so cases like that, where the person loves talking about their condition and their disease and their problems, I can't help them. I can't help them. Why can I not help them? It's not because I don't want to help them. It's because they don't want help. So if you have been trying to get a family member or a friend or someone to come see us or to do telehealth, to get on the phone with us, and they won't do it, it's not because you didn't say the right things. It's not because you don't care. It's not because you don't love them enough. It's because the person may identify with that condition, and they're afraid that if you took their fibromyalgia away, or if you took their diabetes away, or if you took their obesity away, if you took their arthritis away, they would not know how to live their life. So hopefully you guys, this is making sense. So any case, any disease, any condition, we are always happy to look into that case. And then myself and my associate practitioners and Dr. Dean will talk to the patient and see, what do they want? Do they want to get better? If they really, really, really want to get better, like some of you guys on here who've had amazing wins, from weight loss to reversals of diabetes to thyroids that have went from a hypo or hyper condition to normal, to weird rashes, to, I mean, you name it, right? If they truly want to get better and they're willing to do what it takes to get better, we will hold their hand through the whole process to help them. We will be there every week, every step that it takes to get better. But if they don't want the help, if I reach my hand out and they're drowning and they knock my hand away, I can't help them, right? I can't help them. My associates can't help them. Dr. Dean can't help them. You can't help them, okay? All right, so let's read some comments and I'll take some questions and then we'll go. So let's see. Are med beds real? Where are they located? How much to use? How long to use? I don't know about med beds. I kind of laughed because I went for a walk on our lunch break. So we have our staff meeting on Monday. So if you ever call between 1 and 3, it's because we're in meetings in administrative time. It's not because we don't love you. It's because we're working on other stuff. So anyway, so we have our staff meeting on Mondays at 1. And after the staff meeting, I'm like, I need to go for a walk. So I went for a walk and I went to a local park by the office, which is one of the reasons why I love the office, because it's just such a great location. It's so peaceful and healing. And we're really close to the Longwood Police Station and really close to the Longwood Fire Station in this park. And so I'm walking around and walk to the park and I pass by the fire station. And I appreciate the guys and women that work there. And on there, one of their fire kind of like ATV or four-wheeler or golf cart or whatever you want to call it, it said med bed. And I was like, oh, that's interesting, but that's not the med beds that you're asking about. So do they work? I don't know. There's many things that we don't know about. Frequency healing is a thing. Frequency healing is one of the tools that we utilize. But how med beds work and where they're located, all that, I don't know that. That is what is so amazing about quantum, getting to the root cause so the body is able to heal. Masking symptoms is what conventional medicine does, and it is... Oh, I put... Hey, Lily, I love what you said so much. I put it on the screen. I don't even know how I did that. So it's up on the screen. It says, that is what is so amazing about quantum, getting to the root cause. The body is able to heal. Masking symptoms is what conventional medicine does. And it is so misleading to people. Yeah. So just because your symptom went away does not mean, with your medication, doesn't mean that you're fixed. It just means your symptoms suppressed, which means that you're going to have other symptoms. Well, that's cool, Lily. You just taught me a new function and I don't even know how I did it. Okay, but I have a new toy. That's cool. All right. Won't comply. That alone is a disease in itself. Someone that identifies with themselves with the condition they have. Absolutely. Robin says, true, you've helped my mom so much. Amazing wins for her. Yeah, Robin. No more acid reflux. That's cool. Alice says, you've helped me so much. Awesome, Alice. Lily, no RA medications for 18 months now. Awesome. So one of my rad patients came off of anti-anxiety medication, which is awesome. And she is also off of all medications. Do I recommend iodine for children? Yes, I totally do. Our children are being bombarded with radiation, and a lot of them are on a lot of devices. What organic flour do you recommend for baking? So I like the Birch Benders pancake waffle mix. So if that's for pancakes and waffles, my father imports a flour out of Italy. I can't think of the name right now, but when I think of it, I will post it on Facebook. Ideas for extremely stinky feet besides the basics. Okay, so if someone's feet stink, there's a couple reasons why. One reason why is a person's detoxing or they're toxic and it's coming out the feet. Another common reason why, which my daughter does sometimes, is she'll go barefoot and then she'll stick her dirty feet into shoes and then her feet sweat, and the sweat and the dirt from her feet get into the material of the shoes and causes stinky shoes, which then if you put your feet in there causes stinky feet. So it depends, if you're wearing socks, are the socks good socks, meaning do they have cotton in them? Are they all synthetic? Are you in need of detox? So sometimes if you took like a clean bucket and you put filtered water or distilled warm water, you would start to detox out your feet. You can add a splash of apple cider vinegar. You can add a drop of your favorite essential oil. You could put a non-aluminum baking soda in there, maybe a baking soda separate from the apple cider vinegar so you don't have a foaming reaction. But yeah, there's a lot of detox that happens out the feet. So if your feet are stinky, then look to see, is the person wearing, putting dirty feet in clean shoes, and or do they need help with detoxification? Not too far back, a dentist found that element 41 niobium will reverse tooth decay and actually help your body start to rebuild tooth enamel. The government squashed his patent and has been suppressing the knowledge about it, something another dentist can find out and change a lot. Yeah, so a lot of things that work are suppressed. So if you Google something and there's a lot of bad things about it. So if you Google, I'm a doctor of chiropractic, right? So if you Google doctor of chiropractic, you will find bad things about chiropractors. Why? Well, who funds the media? Who funds Google? It's funded by big pharma. It's funded by corporations that make money on sick people. So all the holistic modalities are being bashed, not because they don't work. Chinese medicine's been around thousands of years. Chiropractic's been around since 1895. And before 1895, the Egyptians did spinal manipulation. So, and Hippocrates said, for the health of the body, look to the spine, right? So that is why that happens. Young Living essential oil purification can help when applied to the feet. Sure, that'd be cool. Why purified water, even by itself, work for detoxing feet? So if you have city water and you stick your feet in city water, guess what you're absorbing? You are absorbing the city water. So if you're trying to detoxify, you want good water. So you're not putting more chemicals. Like if those of you that take baths, if you're sitting in unfiltered water, and chlorine city water, which has pharmaceutical drugs in it, it has microscopic or tiny, tiny particles of toilet paper. It has other unwanteds. It has chlorine. It has fluoride. It has mercury in it. If you're soaking in that, you're putting more chemicals in the body. So that's why the best water that you can, so you're not adding more fuel to the fire, if you will. Do you guys use blood tests and hair analysis as well as quantum testing? Angela, we can order any blood tests that you want in the world, any hair tests, any metal tests, any parasite poop test. There's thousands and thousands and thousands and thousands of tests that we can order. We find with quantum, we get answers really fast, saving you thousands and thousands of dollars. But yeah, we can order whatever you want. If someone brings in their blood work, we absolutely look at it. There's a time and a place that I will order blood work. So we use all the tools we have. Just curious, you do so much detox and supplements, food for healing. Why did you go into chiropractic and not something like naturopathic? Okay. So this is interesting. This is kind of funny. I'm trying to figure out the short version for you, Karen. So my mom woke up at 3 o'clock in the morning and found my umbilical cord hanging out of her. And they had previous lost a baby before me. And so she was really nervous. My father rushed her to the hospital. She made sure not to put pressure on my umbilical cord. And the surgical staff at the time gave me 5% chance of making it, 5%. So I guess I'm pretty stubborn and I'm here for a reason. And so that surgical team saved my life. So some people think I don't like medicine and I bash medicine, and it's absolutely not true. The surgeons on that team that day saved my life, and that's why I'm here, amongst I think other reasons why I'm here right now, and reasons why you're here right now. The problem why the umbilical cord, or why I think the umbilical cord was not where it was supposed to be, is my mom has a bifurcated uterus. What that means is that there's two parts and it looks like a heart. So there wasn't a lot of room for me. And because there wasn't a lot of room, my feet were internally rotated. They were kissing each other. And when I was born, once I made it through childbirth, they said, oh, well, your baby's never going to walk because her legs are bent and you need to take her to an orthopedic surgeon, and maybe the surgeon can unbend them and she'll be able to walk. And so my parents were like, oh my gosh, we almost lost her in childbirth. Why would we want to take her to a surgeon to cut her legs open and do the surgery? Like, that sounds pretty invasive. So a friend of the family said, well, why don't you try chiropractic? And my parents were like, well, what's chiropractic? People didn't know what chiropractic was, right? So they took me to a chiropractor. And Robin, you'll appreciate this. The chiropractor was, the confusing thing with chiropractic is there's thousands of techniques. And this chiropractor did a technique called sacral-occipital technique. Her name was Dr. Vicky. And she put wedges underneath my hips and made me certain inserts from my shoes, orthotics from my shoes, to balance out my feet and balance out my pelvis and my hips. My legs straighten out, and I was able to walk, run, play high school sports, play college sports, play professional sports, and it was amazing. And so I was confused on what I wanted to do as a career. I was a student athletic trainer. That got me a scholarship at the University of Florida to work with the Division I football team there. I thought I wanted to stay in sports medicine, but realized that I didn't like the way that career was, and we can talk about that another time. I thought about orthopedic surgery because I thought it was pretty amazing to be able to put somebody's knee or ankle or shoulder back together, until I saw more ins and outs with that. I was like, oh, I don't want to do that. And then I thought, well, physical therapy is really interesting because we work with physical therapists and we do rehab to strengthen these athletes that had surgery, their joints, and to help repair injuries. So that looked interesting to me. But really, it wasn't until I got an injury. I was rowing crew for the University of Florida and playing soccer. And I had an injury called IT band syndrome, where the side, if you feel the side of your leg, it gets really, really tight. And when you run, it feels like a little something stabbing you, like a little knife is stabbing you in the side of the leg. And because I wasn't running right, the bottom of my foot got really, really painful. And there's a band of connective tissue under your foot called the plantar fascia. And the plantar fascia got inflamed too. So it was hurting me when I was running. It hurted me down. It was hurting me going downstairs. It was hurting me constantly, to the point where I couldn't go to nationals in Texas. And instead I went home to my chiropractor at the time, and he's like, well, who's doing chiropractic for you in Gainesville, Florida, at the University of Florida? And I said, well, no one, you're my chiropractor. And he said, well, you're playing soccer. It's a contact sport. You're getting banged up. You're falling down. All these things are reasons why you go out of alignment. And that's why you have IT band syndrome. And that's why you have plantar fasciitis. And I was like, oh, well, that makes sense. So he just did my hips and he just did my spine, and I got off the table and all the pain was gone. And so you would have thought at that point I wanted to be a chiropractor, and it wasn't that point. It was the point where he asked me to work with him, and I didn't want to work with him because I had already lined up the best cool summer job. And the best cool summer job to me back then was working at a camp, a Girl Scout camp down in the Keys. So all I could think was, I'll have fun. teaching these young girls camp songs and cooking and crafting and sailing and being on the beach all summer and come back super tan. And that sounded amazing, right? So you can let me know if you ever went to Girl Scout camp or Boy Scout camp, and one of the ones down in the Keys on West Summerlin Key. It was called Camp Wasumkey. It still exists as far as I know today. Down almost to Key West. And that's what I was going to do. And my chiropractor asked me, well, I was kind of hoping you work with me over the summer. And I didn't want to. I wanted to go work at that fun camp down in the Keys. And my father, being very wise, said, well, what do you want to do for the rest of your life? Do you want to be a camp counselor? Or do you think maybe you should try chiropractic, since, it's the reason why you can walk? And I knew he was right, but I didn't want to work in an office all summer. And so I regretfully declined the summer camp job, which they were not happy with me. And I was extremely sad. And I took the job with my chiropractor, and he was very happy. He's a very nice man. And I absolutely hated it. I hated that job. Why? Because he had me calling patients that owed him money. I didn't know these people. I don't want to ask people that I don't know for money. I don't want to ask people that I do know for money. That's not a comfortable conversation. I had to do paperwork. I had to do accounting stuff. I developed x-rays, which was cool because back then we didn't have digital x-ray. We had the old school machines. I learned how to do that. And the changing point, the reason why I decided to be a chiropractor was at the end of the summer, he invited me to his school's homecoming. And so it was a big event where docs from all over the world would come back and do continuing education credits and seminars and associate with each other. And they were all buddies and all that kind of thing. And I went there, and I was listening to a very famous chiropractor by the name of Dr. Reggie Gold. And Dr. Reggie Gold had the most amazing ability to explain chiropractic in the most beautiful way you'd ever hear in your whole entire life. And because of this, I'm going to have to go find a video clip of him on YouTube and show you. And so he explained how chiropractic unleashes the body's potential, and how the body has this intelligence called innate intelligence that allows the body to heal, and how putting the vertebrae back into alignment takes pressure off the nerve, unleashes the flow of the nervous system. Since the nervous system controls every single part of the body, every organ, every gland, every tissue, every cell, it can positively affect your whole entire body. And the way that he described it brought tears to my eyes, gave me goosebumps. And I was like, I want to be a chiropractor. So that's how one of the worst summers in the world became the best summer. And that's how I got into chiropractic. How did I get into nutrition? I got into nutrition because a couple years in practice, I got super sick. And nutrition was what saved me. So chiropractic is the reason I can walk, and nutrition is the reason why I'm alive. Okay, cool. All right. So Dragonfly, I'm glad you could feel part of that passion. That's cool. Let's see. Won't comply. Her arm is numb from the elbow down. So elbow down could be neck related. It could be something else. Could be elbow down. Karen, you're welcome for asking me that question. That's cool. Lily, yes, I had a divine calling to be a chiropractor. Absolutely. I absolutely did. And I love what I do every single day. And then the combination of quantum nutrition and chiropractic is magical. It's so cool. All right, guys. Well, with that, I'm going to let you go. If you want to learn more about quantum nutrition testing, you can go to qntacademy.com. If you want to learn or hear about chiropractic, you can search YouTube for Dr. Reggie Gold and understand how the body works and how innate intelligence works and how chiropractic works. And if there's anything I can help you with on any of these topics, I'd be happy to help you. The office website is Palmer Natural Health. Thank you, guys. I hope you have an awesome night, a relaxing night, and a lovely night. I'm Dr. Lisa Palmer, Dr. Mama Bear. Good night.